I have sunken, hollow eyes. What is the best treatment option but not really expensive?
Thank you for your question. You've submitted your question with a single photo, although the photo is kind of dark, but I think I can see what I need to see. And you're asking about a situation where you feel you have hollow, sunken eyes and you want a procedure to treat them and you want something that's inexpensive. Well, that's certainly an important type of question, and I'll share with you experience about handling situations like yours, which we deal with every day in our practice. A little bit of background: I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and dealing with puffy under-eye bags and hollow sunken eyes is pretty much something we deal with every day in our practice, and we have a lot of experience, and I have patients who come to me from all over the world for this type of problem. So from my perspective, when I see this photo, I can understand where you get the idea that you have hollow sunken eyes. But I think that it's important to also recognize that it is clear that you have under-eye bags. And so the question of hollowness is actually relative to the presence of the under-eye bags. So the bags under your eyes essentially are like a mountain, and the hollowness is like a valley. So to understand what your problem is and then go over what the options are for solutions, the first is to understand anatomy. So what happens as we deal with these anatomic changes, whether they are genetic, age-related, or a combination of both? Well, the main thing with the under-eye bags is you have lower eyelid fat prolapse. Lower eyelid fat prolapse is like a hernia. We've actually referred to it as fat herniation. It's fat that's forward in front of the rim of the bone of the orbit, the bone around the eye, and it creates this appearance of under-eye bags. So in modern times, we actually have a saturation of providers of different levels who are ready to offer you what they claim to be the best solution. And I'm saying this because I want to address that inexpensive part of your question. I have taken care of a lot of patients who have come to me who went first the quote inexpensive route. And this is, of course, expensive and inexpensive is in the eye of the beholder. Essentially, one amount of money can be a lot for one person and can be nothing for another person. That's my point. But when people try to solve a problem like yours with solutions, especially from aggressive marketing, very often they end up at these various strip mall, pseudo medi-spa type places where there's no physician supervising, they don't offer surgery, and they are aggressively looking to do some type of non-invasive procedure for you. And so when it comes to something inexpensive, I can promise you people have spent a lot more money in the end after chasing these inexpensive solutions before getting the more definitive procedure, which in the initial perception can be seen as expensive. So what I would recommend for you is something called a lower eyelid blepharoplasty. This is a surgical procedure, and this would involve addressing these under-eye fat pockets in a more definitive way. Now, generally speaking, and of course this is in the absence of a physical exam, my approach to someone like yourself would be a combination of lower eyelid blepharoplasty, which again means that I'm addressing the fat pockets from the inside of the eyelid. This is performed under local anesthesia with light sedation in our office operating facilities that are certified by the Joint Commission, the same certifying body that does hospitals and surgery centers. So essentially we're providing the safety as well as the convenience in one place, and doing this in a way that can be very cost effective, especially when you compare facility and anesthesia costs at hospitals and surgery centers. Now, in addition, we often combine this procedure For people with lighter skin, we do something called platelet-rich plasma, PRP, which is derived from your blood and is used to stimulate collagen and improve the quality of your skin, and as well as do something like fractional CO2 or fractional erbium laser to help improve the fine lines and wrinkles that also contribute to the aged appearance under the eyes. Now, it's also important to understand that there are other areas of the face that often have experienced facial aging because the eyes don't age in isolation, but because the bags may be the dominant feature, you're not necessarily paying attention to these other areas. So there may be opportunities for fillers and other things. But I think it's very important that you understand that quality and cost do often go together, of course, up to a point. What you want is good value. And so I think that it's important for you, if you cannot afford a surgical procedure, to at least understand that there is no inexpensive, quick solution that is an alternative to surgery. These things are sold very aggressively, and they're very enticing for people who have budgetary limitations. But I always explain to my patients that this is not just a procedure, but in many ways it's a real investment. It's an investment in your appearance that can have a positive impact in all areas of your life, including both social and professional. Patients of mine have said to me that after they've had a procedure, they went and got a job, and they were able to get a job even though they were facing, quote, age discrimination. Now, certainly I think that the procedure helped them look better, but in addition, I think they also had the confidence to present themselves in a way that made them attractive for an employer. So I think that there are many ways to really define expense or expensive. And I think that spending a lot of money and not getting results and being frustrated costs a lot more than the actual cost of doing a surgical procedure. I think that if you can't afford it now and you can't get financing, then hold off and wait till you have the necessary amount in order to get the procedure that will most likely be successful. I would recommend you meet with qualified, experienced cosmetic surgeons. Meet with doctors who perform surgery as well as offer all these other procedures. In my practice, we have lasers. We have all of the same things that are offered at Medi-Spas, but in our practice, these are tools that are used when appropriate, and we are not pushing people to do things that are shortcuts, because it's different when a physician is going to offer you a solution and is concerned about providing you the best solution rather than a Medi-Spa or something comparable where they try to sell more than maintain a long-term relationship and do the right thing. This is editorializing, but it's certainly been my experience as a professional. So I hope that was helpful. I wish you the best of luck, and thank you for your question.